Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. In this episode, I have the privilege of being here with Michelle Trudel. Michelle is a national board certified health and wellness coach and a graduate of both the Health Coach Institute and Well Coaches Center of Coaching Excellence. She is a certified empowerment self-defense instructor, boxing fitness trainer, and a Yoga Alliance certified meditation teacher. She is trained as a workshop leader with the Radical Remission coach team and is a serious student of herbalism under Rosemary Gladstar. She basically views her entire coaching practice as self-defense as a lifestyle. Welcome, Michelle.
Thank you. Thank you, Jessica. It's nice to be here.
So wonderful to have this opportunity to speak with you. I wanted to begin by asking if you could share your journey to becoming a health and wellness coach.
Oh gosh. Well, in a nutshell, I think I've thought about coaching for years and years, and it's been one of those things that sort of was in my sphere in terms of the people I was surrounded by. And one person in particular, Carrie Peters, I was going to say, should I name her? Of course I should. Carrie Peters founded the Health Coach Institute. And Carrie's been a friend of mine from the theater world. I've been a longtime Chicago actor, and she was also part of that world. And she was working in the hospital where I currently work. I work at Northwestern in Chicago downtown. And Carrie was there. And so we were friends outside of the hospital as well as sort of kind of colleagues. And she was letting me in on her journey. And I thought, my gosh, this is exactly what I want to be doing. And I watched her, I listened to her stories. I watched her start her own coaching school, which has gone on to great success. And it took me, gosh, I was way behind her. I remember back in, might have been 2011, I'm not even sure, but I was at her first talk as a coach, and I was so proud of her. And I do remember thinking, if there was some way I could make this happen to be just like Carrie when I grew up. And Carrie Peters was someone who gave me some incredible advice that changed my life. And so I finally went to the school that Carrie started, which was Health Coach Institute. And that obviously changed my life. So honestly, what was pushing me to do it was, and it'll come around to the whole self-defense thing. When you work in a hospital and you see certain behaviors going on with patients, for example, a cancer patient standing outside smoking a cigarette, folks engaging in behaviors that are going to come back around and harm them. I just always remember thinking, do we have interventions for this? Are people talking to people about this? What can be done here? And I remember reading the China study and getting really heavily into lifestyle medicine, not as a physician, obviously. I'm not a physician, but that was one of my hobbies as far as reading. It was about lifestyle medicine, lifestyle interventions. And it was all happening while I was watching Carrie. And she was basically doing the lifestyle interventions with people, changing people's lives, talking about diseases of affluence, we like to say, diabetes, cancer, heart disease. These are a lot of these diseases that befall people are based on choices that people make. And how can we intervene and maybe get somebody to make a different choice? This is where the self-defense piece starts to weave in. It is an interesting story in the sense that, and I will come back around, whenever I talk to a client now, because I'm talking in the present now, I love to remind people that your story is so interesting. You could write a biography or an autobiography, and I would read it. I would buy it. I'd be interested. I think people are fascinating. And by the time you get to a certain point in your life, you're a package. You've had so many interesting experiences. You have learned so many things. You've got certifications. You've got experiences, travel, whatever it is. It's all in here. And for me, it became a really interesting mishmash of I'm a self defense instructor, I'm also a coach. And when you talk to other coaches about, well, what's my niche? Who do I work with? Who do I talk to? If you look at who you are as a package, that's where your niche is. So my journey as a coach is parallel to my journey as a self-defense instructor. And my niche became really clear with all of that hospital experience of what if we could teach somebody to defend themselves against lifestyle disease, against certain things that happen naturally with aging. Maybe those things don't have to happen. Um, I know that's a big roundabout answer to your question, but I can't separate any of these things anymore. Everything comes into play when I think about my journey to coaching. It's like everything has sort of gone like this, being in the theater world, being in the self-defense world, and being in the coaching world. It all becomes this package. And I love this work. And I got to meet you through it.
Obviously, all these beautiful pieces of you make you who you are. And just in reflecting on our own life's journeys, it's amazing to think how in healthcare, just things are so compartmentalized and so specialized. And, you separate the heart and the lung, you separate all these different, anyway. So when you think about holistic treatment or transformation or having that empowerment, how can you not look at the whole person? And so by honoring all the pieces of ourselves, which you so beautifully do in every way, that just helps us be able to transfer and help other people do it for themselves as well.
Yeah. And some of us have more choices than others. When we talk about making good choices, sometimes it's also about having good choices. And if we have good choices, we can make those good choices. And I'm paring it down right now to the people that actually have good choices to make. If coaching clients, if actually coaching people can make them independent in a way that they didn't think they could be. You know, I've had people say to me, I have no idea what my doctor is talking about. I have no idea what it means to live a healthy lifestyle. I have no idea. I'll go, okay, well, let's explore that. And I think that's the majority of people, which is troubling. And being a coach is such a privilege to have somebody be vulnerable enough to tell you that. Like, I don't really know how to do this, because we're so conditioned to never say we need help. And so being able to help somebody is such a privilege.
Absolutely. And just obviously, with a lot of respect and cultural sensitivity, it's no secret when you talk about healthcare, diversity, equity, inclusion, there's so many access issues and there's so much just access to care and disparities in healthcare, obviously vary, socioeconomic status, all of those social determinants of health that impact us all. And so when you think about it, when you talk about coaching and self-defense and advocacy and health advocacy, it actually seems like a wonderful bridge to help bridge those gaps in access by reaching people who may not have any other point of contact into the healthcare system.
Well, it's so great that you word it that way, because I know that you and I have had other conversations where the social justice piece of coaching has come up. And I've always thought of coaching as a social justice movement, really. And just like self defense is the type of self defense that I practice, is called empowerment self defense. And it's a movement that started in Europe. So again, it's like everything I do as a coach, and probably everything you do as a coach, if you really look at it, it is about social justice. It is about social change. And what are we trying to change? We're trying to change basically what's going on in the healthcare system in this world. Even if you're not necessarily looking to coach in a hospital scenario or for a doctor's office, it doesn't matter. You're still moving the needle towards a change in the paradigm of here's a person who doesn't know what it means to be healthy, and you're going to teach them. So coaching is inherently revolution, and we need it. And it doesn't matter what kind of coach you are.
It's such a huge transformation. And again, there's been so much evolution in technology and just even our structure of our healthcare system. When you think about managed care over the past century, this whole conversations piece, making eye contact, having this holistic big person of who it is you're trying to help heal. And the healing comes from the person being healed, right? We're here, but it's the person being healed who has to do the healing. And unfortunately, so much of that gets lost in our healthcare system when there's barely time to see patients and there's so much overload and administrative burdens and all these things. Obviously, our system is strong for certain things, acute care, and they're very grateful to be in the country with healthcare system, but there is a lot wrong with the system. And so when you think about coaching and it being political, it's almost like every healthcare provider, whether they call themselves a coach or not, these skills are unfortunately missing from our education. At least I know they're missing from medical education in most schools. And so to be able to view the patient, to be view another human being as wise, whole, and resourceful, rather than being told what to do or needing to be fixed, that is a huge revelation within itself.
Oh my gosh, yes. I'm so glad you said that. I was at the survivorship conference at Northwestern in March of this year, and they did a wonderful job of outlining the gaps in care and where coaching could actually fit. And I kept that slide presentation because it's a primer for what we're all trying to do. And you're 100% right. At least I can only speak to the oncology world, but when you get 10 minutes with a patient every 6 months, it's not enough. It's not enough. And we have a wonderful program for standardized, it's called Standardized Patient at Northwestern, where actors come in and basically they're teaching these physicians how to listen and how to have empathy because it's not really taught in medical school. There's too much to learn. And the idea that coaches could literally change the system or at least illustrate in the most beautiful way how the system, how badly it needs changing. There's no question to me that this is a political statement of its own. Because I've been wondering myself for a long time as a coach, what would happen to the healthcare crisis if fewer people got sick? I mean, it's such a bizarre, simple question. But if people had access to coaches, what would that do to the world if there were 10 million fewer sick people? Maybe the system would respond to that and say, there's something here that could be done better. So there's so much to say on that topic. It's just huge. And that's why I'll never stop saying to other coaches, you're a social justice warrior. And don't ever think for a second that what you're doing isn't important. You know, we all have sessions with clients that land beautifully and you come away as a coach feeling like $1,000,000. And then we have sessions where just couldn't bring that one in for a landing. I wish I'd had an extra 5 minutes, or I wish I'd said something differently. And you feel like, oh, darn it. But we don't know how it lands really with the client. And you said something really important a minute ago about trusting that the client is the expert on their life and letting the client has to do the work. We can't do it for them. But when they do the work, that's where transformation happens. And sometimes it does happen by inches. But there's nothing like it for a client who doesn't necessarily speak the same language as coaches do. And you and I can be so steeped in coaching language that we think, oh, this client is going to be so unmoved. And then we discover that They tell you 2 weeks later, oh my gosh, that session I cried afterwards or something. You just don't know. And having faith in your ability as a coach and faith in the coaching profession in general, it is going to move mountains. I really believe that.
How many industries do you get that one conversation having the power to really change somebody's life?
Yeah.
And learning how to do that.
Yeah. And when is the last time somebody sat down with you and looked you in the eye and said, so what's the best thing that happened to you this week? I mean, what? Nobody talks to people like that. Or sits down and just says, tell me about that thing. Tell me more. Please tell me more. People don't have that opportunity, especially when it comes to their health. They don't get to talk about those things. And to have somebody actually spend, I mean, I prefer, I'm just going to say it, I prefer 55-minute sessions or longer. I like the long sessions. I find it dissatisfying to have only half an hour or 20 minutes with a client. I don't like that so much. But even if it is only half an hour, it's almost like people exhale, and it's really wonderful to hold space for that.
I'm feeling an internal exhale as you're just saying that. It's amazing. You had mentioned the empathy and how at your organization they have actors come in to help that. And it's so interesting because when we go into medical school, at least I can just speak for medical students and physicians, we go in with an ideal of thinking what this job will bring us, thinking what fulfillment it will bring, thinking about the kind of interactions we're going to be able to have with our patients, not realizing what the system is until we get there. So it's like you go through all this student ideal and like wanting to cultivate empathy, and it comes out because as a med student, you often have more time to talk to a patient than maybe during other times in your career. And then by the time you get through your physician training and then to actually practicing, what is the condition around you that you're working in that does that even allow you to sustain your own health, and how can you recultivate empathy or like get in touch with that side again? So it's wonderful because it's hard, it's taught, but then there's such a gap between the way the system is and the ideals of it. And so not only is there a gap for patients, there's this huge gap for providers. I thought about coaching as health advocacy, as self-advocacy, obviously in the social justice sense. I hadn't really thought about too much with that self-defense lens until learning from you. And so I'd love to learn more about the empowerment self-defense that you were talking about.
Sure. And before I get going on that, I just want to say that if there are coaches out there who are interested in coaching providers, boy, they could use it. You and I were talking earlier about the burnout from 2020. Providers need coaches too. So if anybody out there is even thinking about it, go for it. As far as the empowerment self-defense side of things, we call it tools, not rules. And it's self-defense without the martial arts. So a lot of time people hear the word self-defense and they think, oh my gosh, I've got to go get a black belt first. I've got to go train somewhere first. I can't even walk into a self-defense class because I'm not in shape or whatever it is. But the wonderful thing about empowerment self-defense is that in a 90-minute workshop or a 2-hour workshop, you will come away realizing that you, Jessica, you are walking around with a superhero tool belt already. It's on you at all times. Mine's on me right now. And we just didn't realize how many tools we actually have. And when we say tools, not rules, it's almost that applies to coaching as well. There's no one way to coach somebody. And we come into coaching hopefully with a whole lot of tools. And if we are really present with someone, there is no two sessions, no two clients. You're never going to have the same exchange. And so that's where the listening comes in. And as far as the self-defense piece, bringing that into coaching is kind of a no-brainer for me because empowerment self-defense is also about really strong boundaries and the way we set boundaries in life in any situation. It's a life-altering skill to be able to have strong personal boundaries, whether it's dealing with a predator or dealing with the next virus that's going to come around. And that's kind of how I envision it as a coach, is defending yourself from all the things in the world that are going to keep coming at you. And when you know you have this tool belt, it becomes less of a worry. You don't necessarily have to go through the world scared or worried. It's about knowing that you can handle whatever comes. And that's something that kind of goes against the conditioning, at least that women get. Women are very much conditioned to be afraid. It's, the sun's going down. Be afraid if you go out after dark. So many ways that women are oppressed in this culture. We're swimming in it. Empowerment self-defense pushes back against that. And as a coach, I think I push back in my own mind about when someone thinks they can't change their habits, their life, the way they interact with their family. When someone really thinks I'm stuck, they're not necessarily. They maybe just need to talk it through and realize that they have their tool belt and they have so many tools at their own disposal that maybe they just forgot were there. And that's something I love about coaching. I love merging those two worlds.
It sounds like the niche of coaching, because there's different ways to do it, right? You can niche yourself by the population you serve or by the transformation you're providing. And so by shifting to that space of empowerment, it's life transforming.
Yeah, and it's interesting you should say that, because I think about that myself often when I call myself a self-defense coach. It opens up the population that I might be working with. And I used to say I will only coach women, because in my mind, women have gotten the shaft in many, many ways over hundreds of years. Men don't need my help. But the truth is that everybody needs transformation if the world's going to change. Everybody needs to change. So I very happily have accepted all genders into my coaching practice. And what I've learned from that is changing my own level of hope, if you will. I see people changing that might have been part of a group that stereotypically you would think, oh, there's no way this person is going to open their mind. And turns out anyone can open their mind. Anyone can change. And if you're willing to get in the ring with them, it changes us too, Jessica. And that's a beautiful thing. I know this isn't part of the question, but as coaches, I mean, I'm sure you've felt this. We are changed by our clients. And we'd be lying if we said we weren't. And it's an incredibly rich experience, especially when you look at the timeline of starting to work with someone. And if you get the privilege of working with them for say 3 months, 6 months, and sometimes I look back to the very beginning of my client notes and I think to myself, how did I ever get this gift to be able to work with this person and watch them do the work? In a world on fire, it reminds me that we can save ourselves.
Such powerful, vivid imagery in that last sentence. You were just saying about how it's a gift and how each experience changes us. It's really interesting because just by being present with that person, it's like when they get their ahas or their shifts, something shifts inside of us, whether we can name it or not, like what you're saying. And that was one of the hardest things, to be honest with you, about working in healthcare, especially in emergency medicine. There's so many rich encounters you have with people, with patients, their families, with your colleagues, and there's very little time to process any of it. And then if you don't process it, it obviously manifests in good ways and in some ways in a way unprocessed events face. But that's one of the things about coaching, that self-management, that self-awareness is so powerful. So I'm really grateful that you brought that up.
Well, I'm grateful that you brought this up in this way, because when you look at what a provider is experiencing in the hospital environment, for example, we don't necessarily think, as patients, we don't necessarily think about the provider. We don't have time to think about the provider at all. And so your experience as the provider versus your experience as coach, what a different world that is in terms of when you're talking about being able to process. I'm trying to imagine what it would be like to have client after client after client after client and not be able to take a breath and to sit with what just happened. And I'm so grateful that you took that experience into what you're doing now. And you can say, okay, I know how to take care of myself. And that translates into better client care and the ideas that you have about how to change the paradigm. It's there's no wasted moment here.
It takes a lot of reframing to look at it at the beginning anyway. When you transition careers or do anything, I know you had transitioned too. It takes time and it's process. And one of the things that's also coming up is just the psychological safety. Like even just this conversation with you, even though it's on a podcast and people will be listening to it, but just having this brave space to just share authentically is really powerful. And so one of the things I really wanted to ask you too was when you get to this niche of empowerment, self defense coaching, and you're transforming fear, your cognitive shifts, you're having people transform not just their physical, like you mentioned, it's their being. And so I'm curious if you have maybe there's some trauma that might come up or whatnot, but to really cultivate that psychological safety at that level with that kind of coaching that you provide, do you have any insights as to how to do that? Because sometimes that psychological safety is missing from other healthcare environments, as you know.
Yeah, for sure. There's so many trainings out there for being trauma aware, and they're so important. It's important to have that conversation. I think I would caution any coaches to feel inadequate if they haven't had some kind of trauma aware training, because honestly, I feel like it's almost enough to simply acknowledge, I know that there has been trauma. There is nothing that you're going to be forced to do in this space. There's nothing you're going to be forced to talk about or forced to do in a self defense space. Anything that's not acceptable to you, you can simply step back. And to me, that's not deep, deep trauma work, but it's more than people get in regular life. In regular life, we don't even get the acknowledgement that every single person walking around us has been traumatized in some way. And just the simple acknowledgement that being human is really hard and some terrible things happen to people. What I have to do in an empowerment self-defense space is almost the same thing we have to do as coaches. I have to walk in, as we call it, fully resourced in myself, feeling that I've done the work so that I can hold the container, and that whatever happens in that container is something that I can handle, and that I am not going to allow anything to harm anyone within my space. And in a small way, that's what happens in a coaching session. I'm never going to force anyone. That's not my job. That's not what we're doing. And trauma work goes really deep, as you know. But I think the very tip of that iceberg is what everyone should be having in terms of their own practice. And that is just simply acknowledging that it's there.
So wise. And that is 101 of trauma awareness and coaching is naming, the acknowledging, asking permission, and not forcing anything.
Yeah.
So, two things just to wrap up. One is, do you have any resources, anything you recommend for listeners out there who are fellow coaches or healthcare providers to learn more about empowerment self-defense?
I do, actually, right in front of me. I have 3 of my favorite books One of them is probably my number one. It's a relatively thin book, relatively easy read. It's called Beauty Bites Beast. And this is basically the story of empowerment self-defense. And the great thing about Beauty Bites Beast is it names the structures that we're swimming in, because we're swimming in power structures that we are so used to. We're so used to certain things just happening that if we call them out, that's revolutionary. And there's sort of an addendum to Beauty Bites Beast called Get Empowered. So the empowerment self-defense world is so cool. Everybody's extremely supportive of each other. And we all talk to each other all the time. And it is literally a worldwide situation. I have colleagues in Albania, in Tanzania, Kenya, Canada, all over the United States. These people are very, very serious about this, which is a wonderful thing. The Gift of Fear, the subtitle is Survival Signals That Protect Us from Violence. This is a classic in violence prevention. So I throw that in as my third recommendation for anyone who's interested in empowerment self-defense, not necessarily coaching, but actually practicing empowerment self-defense. We call it ESD. But Beauty Bites Beast first.
For those listening, the show notes will have the book recommendations. Thank you so much, Michelle, for sharing that resource.
Thank you for asking.
Yeah, I'd love to just conclude with the takeaway. What is your take-home message for listeners?
Oh gosh, I feel like this was a very rambly conversation because there's so much to talk about with coaching. And I think my first hit of a takeaway is, and this is coming from a conversation that I was listening to in a training the other day, because as coaches, we're always doing these trainings, as we should. There was somebody talking about their niche, because coaches are always told, especially young coaches, you have to have a niche or you can't have a business and all of this. And I would just say that look at your life, look at what you do, look at what you've done, look at what you love, and your niche is in there. It's in there. Do what comes organically to you. And I say that as someone who, Jessica, you've done a wonderful thing allowing me to sort of verbally explore my own practice in this conversation, how it all goes together with what seems like two different things, empowerment, self-defense, coaching. They really aren't two different things. But my practice comes from looking at the timeline of my life and looking at my own autobiography. I can pick out, oh, these are the things that matter to me. And that's what created my niche. So if there are coaches out there who are just going, I don't know who I am as a coach, I don't know what I'm doing, I would say, if you're coaching, you're changing the world. Number one. Doesn't matter if you're thinking, oh, I don't have my niche yet. Number two, if you really consider that you are a package, you are someone, I would read your autobiography. You're so interesting. I think humans are fascinating. Remember that you're a package and your niche is in there. That's my first two takeaways from this conversation. There's about 100 takeaways.
Thank you so much. One of the biggest ones I'm always humbled by is just that the whole picture of who we are, just all these steps make us to everything we do. And so it's such an honor to connect with you. And thank you for sharing your journey and your expertise.
Thank you. I really truly believe that there are no wasted experiences and there are no wasted moments.
100% agree. Thank you, Michelle.
Thank you, Jessica.
Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.